Hi, my name is Shannon, and I'm an advocate for mental health. Today, I would like to discuss the importance of mental health issues and why it is an important discussion for myself, for you, and our whole communities. What is mental health? 1 in 5 people are affected by mental health disorders. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life from childhood and adolescence through adulthood. Mental health affects everyone. 1 in 10 young people have experienced a period of major depression, while 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. Half of all mental health disorders show the first signs before the age of 14. Public policies make a difference in the lives of both the people living with mental health and the people in their lives. Changes in policies can make better outcomes. The National Alliance on Mental Health Illness hopes to invest in mental health and innovations in 2017 with priorities in the policies. We hope to reject Medicaid caps and block grants that drive down innovation and force state program cuts that will put individuals and mental health illnesses at risk. We also support Medicaid expansions with income-based eligibility that will provide coverage for individuals with mental health conditions. We hope to ensure insurance reforms that include mental health and substance use disorder coverage in every health plan and at the same level as other health conditions. We want to promote early intervention for serious mental illness through continued federal funding that has been set aside in a mental health block grant to support research. We wish to improve integration of health and mental care through policies and financing that integrate behavioral health expertise into primary care. We want to support caregivers by extending the existing caregiver support programs to include family of caregivers of the people with mental illnesses. We want to increase capacity for mental health care and promote continued care of military service members and veterans with mental health conditions. We hope to end the criminalization of mental illnesses by reducing the cost of jailing people with mental illnesses. We want to make sure that there is a behavioral health crisis team available for them 7 days a week, 24 hours a day. If the insurance reform does not include mental health coverage, these individuals may not have mental health coverage. Before the American Care Act, mental health coverage was not included, and only 17 states required plans to include mental health coverage. Only 5 states required that insurers offer coverage that gave the option of mental health coverage with an additional charge. 1 out of 5 people with individual coverage had no mental health coverage, and those that had coverage faced costly surcharges and had limits on what would be covered. NAMI forms strategic and innovative partnerships with foundations, corporations, federal agencies, and individuals that share our vision of a better world for our people affected by mental illness. Through these sponsorships, we are able to raise the profile of mental illness in communities throughout the country. NAMI has a robust and vigorous assessment procedure and policy to ensure we partner with corporations and associations committed to the values and mission of our organization. Mental health is an issue that is often overlooked, but is a very serious issue. It may not affect you today, but it could affect you or someone you know tomorrow. Let us work together to end the stigma of mental health.